Hello, everyone. Hello, hello, hello. Hi. I hope you guys are able to hear me. Can you hear me? Hello, everyone. If you can hear me, just say hello and tell me where you're viewing us from. Hi, this is Q&A with Dr. Mercy. I'm Dr. Mercy Ajonwe, and we're just going to wait a moment. We have a special guest with us, actually, our friend. She has been here many times before, and I'm about to introduce her. But I just want to make sure that everybody is seeing me right now. So if you can see me, just say hi. Let me see. Oh, yes. Hi, Mickey. Hello from Atlanta, Georgia. How are you? Hi, Sheila. How are you? Sandra, how are you guys doing? Hello, hello, hello from Puerto Rico. Oh, hi, Cynthia Vasquez. How are you doing? Awesome. From Woodlands, Texas. Oh, close by. Hi, Renee. How are you doing? Welcome, welcome, welcome. Welcome to a wonderful conversation we're going to have today. Today, it's about COVID updates with Dr. Gertie. And so Dr. Gertie Anuoke, she is an infectious disease specialist. She resides in Louisiana. She has done multiple talks. We know her here. She's also the infectious disease committee chair for the Association of Nigerian Physicians in the Americas, amongst number other positions. And we'll have her tell us the different positions she actually holds. So without further ado, let me get Dr. Anuoke on. Just a second. Let me add to stream. Hello, hello.
Hello.
How are you doing?
Hi.
Hi, how are you? Welcome,
I'm
welcome,
good. It's
welcome
kind of
again.
faint.
Huh?
I said the volume is kind of faint over
Oh, the
here.
volume is faint. Can you hear me? Or you can't hear me.
I can hear you, but it's kind of slight.
Oh, wow. Okay. I wonder why that's the case. I can hear you very well.
Oh, okay.
Okay, let me see.
Well,
Can
I'm
you
gonna
guys
I'm
hear
gonna
me?
strain.
Okay. Okay. All right. Well, welcome. Welcome. If you guys can't hear me, type it in the comment section. Welcome, Dr. Anuoke. Thank you so much for coming and giving us updates on COVID-19. What other positions do you hold as well? I know you're practicing infectious disease. You're the infectious disease chairperson for AMPA, the Association of Nigerian Physicians in the Americas. But can you tell us more on what other positions you hold? Can you hear me?
Yeah, you said, can I tell about what?
Other positions you hold, other positions in the field that you hold. Okay. It seems like we have some technical difficulties. Let me see if I can get her on here.
Hello?
Yeah, can you hear me?
Yes, I can hear you.
Okay. So I was just asking other positions that you hold as well. Let me get you back on here. Can you hear?
Yes, I can hear you.
Okay. Let me see if you're able to talk. Are you able to talk? Can you hear me? Okay. It seems like you're on mute for some reason. Okay. All right. So we were just talking about other positions that you also hold, as well as being the chairperson of AMPA.
Chair of AMPA Louisiana chapter.
Yes.
Also chair of the COVID-19 task force. I'm chair of the infectious disease committee. I think the position of the COVID task force and the infectious disease committee goes together.
Yes.
But then I do other stuff that's not in AMPA. I am the president of the United Nigerian Women Association.
Yes.
Here in Baton Rouge, Louisiana.
Yes.
I'm also the vice president of Igbo Union. That's my tribal organization.
Okay.
And some other stuff that I do.
Okay. Great. Can you still see yourself? For some reason, we're having some technical difficulties. It may just be because I don't see you anymore. Can you guys see me? I think we're having some technical difficulties here. Bear with us. Can you see yourself in the StreamYard?
No, I don't see myself and I don't see you.
Okay, can you re-invite can you get back on? Okay, you guys, we're having some technical difficulties. Just one moment here. We should be back in a moment.
Check my card is on that cupboard.
Okay.
Okay, my card is on the cupboard.
I think you'll probably have to get back on there.
Okay, maybe I have to log back in or what?
Mm-hmm. Okay. Nope. Okay, you guys, I don't know. You guys can see me. We're having some technical difficulties while Dr. Gertie is trying to get back on. We're talking about COVID-19. Please type in there what your questions are. I mean, she's an infectious disease specialist, meaning that she deals with this on a regular basis. And so if you have any questions as far as what is the Omicron, or what should we do now that we're seeing different variants, about this whole travel ban, about just are we changing, should I get the booster, should I not? These are questions. If you have any of them, make sure to ask them. This is an important time to ask right now. So can everybody still see me? I think we can still see me. Okay, good. So yes, we are just about waiting for her to get back on. As y'all are aware, the Omicron is the newest variant. Well, there's been other variants that have been also in the environment. It's just the Omicron seems to be the one that everybody has been talking about. As you guys probably heard, it supposedly first was originated in South Africa, and there was an endemic explosion of cases in South Africa. And so the South African government decided to let the world know, hey, we have this new variant, Omicron, brace yourselves, because it seems like it's spreading, and it's spreading quickly. And so as a result, you had, the US government as well as some European governments trying to, restrict travel from South Africa and some of the southern parts of Africa. But then you started hearing cases in UK, and then you heard a case in Canada, and then finally you heard a case in California. So how are we supposed to get prepared, seeing that this Omicron has now reached the American shores? That is one question that we will be asking the infectious disease doctor, Dr. Gertie. Also, has all of you guys done your boosters? Recently, it's been told that the FDA has approved for boosters to be administered for adults. And so if anyone wants to get the booster, you should be able to get the booster now. Okay. And so having the booster does help with your immunity and to now fight against, variants of COVID-19. According to Dr. Gertie, we did a little pre-show. She did point out that so far, Pfizer and Moderna are actively testing their vaccines to see how effective these vaccines are against Omicron. And so the verdict is still out there. But everybody says, in general, they recommend you do keep your vaccinations updated. So if it's been 6 months since the last vaccination you've had, it is a good idea just to get the booster, especially if you are immunocompromised or immunosuppressed, because those are very high risk of getting the severe form of COVID. Okay. I remember recently I was in a discussion in regards to COVID, and people have this misconception that just because you're young and you're healthy, that, you should be fine. If you get COVID, you should be fine. But what I've seen in the hospital is that you do have people who come in who are young, who are healthy, don't have any comorbidities, and yet they're the ones that we're intubating. So the thing with COVID is you just don't know. Ideally, yes, the younger population, they tend to fare better when they do get COVID, but it's not everyone who's young that actually has a good outcome after acquiring COVID. So it looks like Dr. Gertie Anyuoke is here. So let's get her back on. Let's try this again. Hi. Okay. Can you hear me this time?
Yes, I can.
Okay, finally. So it looks like we can go ahead and start. So I was just telling them about the whole Omicron variant, and supposedly it came from South Africa. Is that correct?
Well, that's who first identified it. South Africa, they have a very advanced genomic lab.
Yeah.
The whole HIV and all that stuff. So they are very well developed in those things. And when they actually got the COVID variant, as a fluke. Somebody, one of their private labs was looking at it and said something was different. And then they decided to just push it along and got it all sequenced. And that's how they found out that this was a different variant. So they caught it early. We're not sure exactly where it emanated from, but South Africa identified it first.
So it's important to note that we're not sure if it is from South Africa, but they were the ones who first identified it. Right. What do you think about the whole travel ban? Is travel banning? Is that helping? Does that help in general to stop the transmission of this COVID virus?
The truth is, it doesn't stop the transmission, but it can slow it down. But if you look at it already, the United States requires you to come in with a COVID negative test. They don't care about whether you're vaccinated or not. Because people that are vaccinated can carry COVID, right? So the United States, I think, is doing it right. Europe, a lot of the countries where, like, once you show us your vaccine status, you can come in. They weren't checking at some point recently. They weren't checking if you're COVID negative or COVID positive. So I know they said a certain percentage of patients that came from Africa to one of the European countries were positive when they came down from the flight. But the point is, you had checked their COVID status before they came out from the country, you wouldn't have that many. These are all the people that were vaccinated. They were just checking their vaccine status. So I don't think it is fair to label Africa as such.
Yeah, I agree with you. I think there was a little bit of political power play in that. And that's something that I've found very frustrating, is how politicized COVID has been. I wish they could just stick with the science. And I feel like if they stuck with the science, we probably wouldn't be here how we are today. Now, let me ask you, and then I'll go through, because there's a couple of comments here, and I wanted to see if you can clarify some of what some people are saying. But what do you think about the future of COVID? Is it here to stay, or do you think we're going to get eradicated at some point? What is your thoughts?
That ship has left the shore a long time ago. COVID is here to stay.
Mm.
We could have been able to perhaps prevented, full-blown COVID year in, year out earlier on. But at this point, we can only manage it. Yeah, COVID is here to stay. COVID and its variants, they are here to stay. That's my opinion.
So Deidre had asked, and I hope I said your name right, Deidre Bray, had just asked, why do you have to wait 6 months for your booster?
It's because when they did the research and looked at blood of people that have taken the vaccine, they see that after 6 months, the vaccine is waning. The antibody level, the titers are waning. And so you really want to boost it up. You want it to be up there so that it hopefully it doesn't matter which variant comes, that amount of antibodies will be able to keep you safer. Even if you get the disease, it might be mild, but it won't be severe, end up in the hospital or even dying. So that's the whole reason why they are doing the boosters 6 months after, is because that's when they've seen that the antibodies start waning after the second dose.
Okay, that makes sense. And then someone had also asked this question, do we have to take annual vaccination till we die? So essentially,
I don't think anybody knows that.
Worded.
Yeah, I don't think anybody knows that for now. We're hoping, there are certain vaccines, they're different vaccines. It's unfortunate, it's really unfortunate that, COVID is happening in real time and we're dealing with it in real time to the point where CDC is holding a meeting, the whole country is watching. It never used to happen before. It's just how severe COVID has affected the whole population. And that's why people are asking these questions, rightly so. But if you go back and look at childhood vaccines, right, there are some of them that we give 4 times. Some of them we give 3 times. Some we give 5 times. Some we give 2 times. So it depends on the illness. The thing is that we are watching COVID and developing how we treat it and how we vaccinate with everybody. And I remember this saying, one of my colleagues at the infectious disease committee of the Association of Nigerian Physicians, Professor Igor Ofotokun, he said that it's like building a plane and flying it at the same time. That's what we're doing with COVID. We are really doing this stuff in real time. Everybody is seeing how messy the sausage making can be. Like, okay, you figure this one out, and now we're doing the booster. To be honest, it's really looking like it's 3 doses. But can we tell you we're going to stop at the 3rd dose, which is the booster? No, because we don't know. Right? COVID is happening in real time and we're trying to deal with it in real time. So we have to wait for the time to take place and for researches to go on. For now, we don't know if we're taking vaccines every year. Maybe we will get to some point where we will not have enough after boosting enough for our bodies to take care of it for lifetime. We don't know.
We don't know. So that leads to this one. Will we be asked to take boosters every 6 months? The question is, we don't know.
We don't know. And I doubt that we would take boosters every 6 months, but we don't know.
And I think we had talked in the pre-show about, scientists are looking into perhaps developing a vaccine in which it encompasses a lot of the immunogenicities of the possible variants of the COVID virus. Is that correct? Are they looking for ways to have like a super vaccine that can cover all variants?
I know they're looking for a way to see if they can make a vaccine that it doesn't matter where the variant is coming from, it'll take it. But that's going to be pretty difficult, I have to say, because it's not like the variants are predetermined. The variants make up their own mutations in the amino acids. How do you know which amino acid is going to be mutated out of the hundreds? So it's difficult, but we're watching and see. We're gonna see if they can make it. What I do know is that they can make the vaccine specific to the variant. Like right now with the Omicron, I know that Pfizer, Moderna, and the other vaccine making companies are actually, they've kind of gone in and look at the genetic material of Omicron so that they can make a vaccine for Omicron. But the problem is, what if another strain comes up? Now, as long as the vaccine is good enough to give us enough antibodies, no matter which strain comes on, we have some protection. And so for me, the take home, the main issue is people should get vaccinated with what we have right now. Because that's what's going to make, even if you get the COVID, hopefully it'll make it milder.
Right.
You don't have to end up in a hospital or die.
So, because it just reminds me a little bit of like, the flu vaccination. I know they kind of try to predict the strain that may be possible for that particular season. But maybe it's because they've been studying the flu for many years, and that's how they're able to try to get some sort of vaccination geared to the next season's
and even that
virus.
and even that it doesn't really do a good job, right? Even
Right.
that, because you have to go with, okay, what was here the last season? Okay, let's make a vaccine that, but by then the virus has moved on. So there are some years, I have witnessed some years when the flu vaccine only worked like 30% of the time. A lot of times it might work 50% of the time. But we're not going to poo-poo that, because 50% of the time is still good. And like that's half of the people. Yeah, but people don't understand why they're going to take a flu vaccine and still get flu. I get it. What they need to understand is that the vaccine itself is like, it could be a hit and miss, because the time when they got the particular virus strain that's available and they make the vaccine for that, you can have another strain come up within that time that will not be able to, the vaccine may not be able to work well for and still get flu.
So there's this comment that I believe Susanna Berlinsky had kind of talked about, and that is the association of miscarriages with vaccinations. Is that a true correlation? And if so, is that something that pregnant women should be worried about when they are contemplating getting a vaccine of the COVID-19 vaccination?
No, to be honest, no. There has not been any evidence to show that the vaccine causes abortion or causes miscarriage. It's no evidence. People can get pregnant sometime and get spontaneous abortion. It doesn't have to be as a result of the vaccine. That you got the vaccine and then you have a spontaneous abortion does not necessarily mean a causal link. Like I said to a friend of mine, the day I got my vaccine, if I was coming on the road and I got an accident, the vaccine didn't cause the accident, right? It's not a causal agent. And it doesn't matter if that patient did not take that vaccine, they probably could have gotten an abortion on that day. There is absolutely nothing in the RNA vaccine so far that shows that it is linked to causing abortion. But there is a lot of evidence that shows that if you get COVID while you're pregnant, it can lead to COVID itself causes blood clots, and the blood clot can cause problem with the pregnancy. Not only for the pregnancy, but for the pregnant woman, it can actually lead to her death. That is something that is proven.
Wow. Well, keep writing. Everyone, keep writing your questions. We have this wonderful opportunity to ask them to an infectious disease expert. So if you have any questions about COVID, about COVID-19 vaccinations, about, the Omicron variant, whatever, just type them in the comments section and we'll try to get to them. So while everyone's trying to get, the questions typed in, I do have a few questions on my own. And so now switching gears, I heard about the Pfizer and the Merck pills as possible treatments for COVID. That seems a little bit exciting. Do you know anything about that?
Yes, from what we know from data that have been released, and I think that the Merck one has been approved. It works 50% of the time. Now we will take 50%. It's for treatment of COVID. So we're now having more tools in our toolbox. And the Pfizer one, the little data they brought out showed that it will work 85% of time. That's exciting. That's really exciting. That means if somebody gets COVID despite being, vaccinated, you
Yes.
can give them the medication that would,
Mm-hmm.
help. Is something like Tamiflu, but you have to hopefully uh, be diagnosed quickly for Tamiflu to work.
Right.
But for the medications, I think I'm very excited, and I think a lot of my colleagues are very excited that we're
I'm
having
excited
more things.
too.
Yeah. And then for the people that don't want to take vaccines, also, you
Yeah.
might have something that we treat them with that's not an infusion like the antibodies, the monoclonal antibodies. Although the monoclonal antibodies have been made to the point where you can give it as an injection now.
Mm-hmm. So, I mean, we're seeing, so it's the pills. You have I think it's the Remeron. Is it the one that you can do outpatient?
You're talking about the pills?
No, the shot, the one outpatient that you can do.
All of them you can do outpatient. There are like a couple of them right now that
Okay.
have studies that show that you can do them outpatient. The problem with the outpatient thing is that the staffing issues, and they just
Mm,
that's why it's like hospitals are the ones providing that service in an outpatient setting.
mm,
Because you have to have a
mm.
nurse, there are two medications for
Yes.
the other one that you have to infuse one after the other. You have to
Right.
monitor the patient, you have to take vitals, they're time consuming.
Kind of time consuming. Okay. So, given the fact that, the way, you were hearing it on the news, it's almost like, oh my goodness, Omicron is coming to our shores. What are we going to do? It's almost this panicky type environment. What should someone do hearing about this Omicron? First of all, do you know if it is more severe than Delta? Is that something that we should just pay attention to, or should we change our practices of what we are doing to keep ourselves safe? What should we think about when we're hearing about this new variant?
I think everybody should take a deep breath and then, like I said in something I wrote recently, and accept that COVID and its variants have come here to stay. We shouldn't let our guards down. But
Yes.
I think we should do now. It's not like last year when we didn't have a vaccine. I'm not even saying too much social distancing unless I know for sure that that person has the infection. But I would
Mm-hmm.
say at least wear your mask in indoor setting gatherings that have a lot of people. Then with your family members that you are all vaccinated, for how long are we gonna wear the mask indoors? No, we're going to do what we have to do. Take the vaccines. If it's your turn to take the booster, take the booster. Boost yourself up well, such that even if you get the disease, it's a mild form of the disease.
Right.
And anecdotally, Omicron itself, from what we're hearing from South Africa and the few cases we have now in the US, has been mild.
Yes, it has.
Except the one patient that they said is not vaccinated, that they said is kind of moderate symptom. But the other two patients were vaccinated and it's mild. So the vaccination works.
Mm-hmm.
It
Mm-hmm.
works. We don't know too much about Omicron though. They are still doing investigations. It'll take a few weeks for us to have more information. And I know that the vaccine companies, Pfizer, Moderna, they're also trying to test the Omicron with to see how compares to Delta and all that stuff. The truth is that Omicron has more mutations in the amino acids. So
Mm-hmm.
if you think about it, it has like between 45 to 52 mutations in the amino acids of that one virus. And out of those, about 30 of them are in the core, the area of the spike protein that uses to bind itself, right?
Mm. And
And
that's where the vaccinations, isn't that where they're supposed to work around
correct.
yeah.
That's where the binding area. And that out of the 30 that's there, 20 of those amino acids are
Mm-hmm.
known to kind of, if they have too much variation, they might escape recognition. So
Mm.
that's the concern. That's the
Mm.
concern. Has it panned out in real life? We don't know yet. We have to wait
Okay.
for more research and data to say one way or the other.
So you're saying that the Omicron has mutations on the surface protein where the vaccine would normally attach, right? And
Correct.
so as a result of those mutations, it can easily slip away from the vaccine, from it, or from the
Because
antibody,
it
actually,
might not
from the
fit.
antibody. Yeah,
Yeah, because it might not fit that well. So if it doesn't fit that well, it can escape
it can escape
recognition. Yeah.
recognition and then just go and start flourishing in the body. Okay, and that's where the concern is. But we haven't seen that happen yet. We don't have enough data yet
Yes.
to say that that's what
That's
is
the case.
going to happen.
Yeah.
But that's
So
what they're fearing about. And
correct.
that's why, okay, I get it. Okay, makes sense. Makes sense. So someone had written, I believe Deidre again, she said, will children under 5 have to get vaccinated at any point? Is that something?
I think they were promising that might come in maybe early in the new year, or hopefully.
Yes.
That's
Yes.
that they're working on it.
Okay. 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 So they're working on it. Looks like they're working on it. Okay. All right. So another question that I have is, I think that was part of the. It's going back to what I was saying earlier. I said, it's frightening, 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 and so you're pretty much saying, as far as preventative, just keep doing what you're doing. Make sure you're well vaccinated. If you need the booster, go ahead and get it. You're saying we should still do masking and social distancing, and and I know you said this in previous broadcast, but I wanted you to please lay emphasis, and that is optimizing your health, um, and the importance of that. Can you speak on that for some of us who may not have heard you earlier? How optimization of your health and COVID work hand in hand?
Yes. So it's not just COVID, it's any infection at all, any
Mm-hmm.
illness that your body get. If the illness is coming into your body when your immune system is strong, it is hard for it to take you out.
Mm-hmm.
What can we do to optimize our immune system? The
Mm-hmm.
things we can do, we can take the stress can cause our immune system to come down, to run down.
Mm-hmm.
So we have to watch those things that are putting us in stressful conditions. And I know life can be stressful sometimes.
Right.
It is what it is. But
It
we
is what
can
it is.
try to decrease the amount of stress that we have in life, rest more,
Mm-hmm.
do more physical activities like exercise,
Mm-hmm.
be able to know how to sleep, give our body enough rest and sleep. There are
Mm-hmm.
other things like the nutrition that we take.
Mm-hmm.
We want to make sure that we are taking appropriate portions of, protein,
Mm-hmm.
multivitamin, and minerals, and of course, appropriate portion of carbohydrate. A lot of vegetables
Yes.
and fruits will help us a lot with all those micronutrients that help our
Mm-hmm.
immune system work at its peak. All
Yes.
that stuff. So, because you can see some people get COVID, they don't even know they got COVID.
Mm-hmm.
Everyone's immune system is different. Now you can do all that, and then say other people might have diabetes that might be brittle, or have like people with cancer. You can optimize your system, but the fact that the person has cancer is really a big one, because with cancer and sometimes the treatments of cancer can
Mm-hmm.
cause the immune system to go
Mm-hmm.
low.
Mm-hmm.
And so even if you're trying to build it with food, which is still good, you're still working at a disadvantage. That's why people that have cancer,
Mm-hmm.
and remember, there are blood cancer also, like um, General Colin Powell that died,
Yes.
he had taken the vaccine.
Yes, please speak on that, because people are
Yeah,
probably going to wonder why, Colin Powell, who was vaccinated, fully vaccinated, he still got COVID. And not only did he get COVID, he died from the complications of COVID. So
correct.
please speak on that, on what you suspect happened.
Yeah, I think what happened was he had I think prostate cancer, and he also had
Mm-hmm.
multiple myeloma. Those are two cancers right there. His odds are really down because when you give these vaccines to people that are already immunosuppressed, they
Yes.
don't have the ability to mount the fight. I don't know how else to explain it in layman's term. When you give somebody a vaccination, you're asking the person's immune system to recognize that you have put an antigen in them and to fight off that antigen.
By what? Creating antibodies,
By
right?
creating antibodies.
Right.
Now,
so it's the creation of the antibodies and other immune cells, right? That will help fight that actual virus.
Correct.
That is entering into your system, right?
Correct. But people that are immunocompromised already, people that have cancer and all, may not even recognize when the antigen comes because their immune system is not firing at all cylinders. So they may end up not even forming all the antibodies that you need to form. And so even though they've been vaccinated, their body didn't do what needs to have been done. And so when they get the disease, it's really a losing battle sometimes. In fact, I used to have this graph that I show the people that are normal population, their vaccine uptake, it's like 97, 98%. The people that have cancer, it could be like 42, 45%.
And so it's not enough. It's below whatever threshold you need to have it to the body to kind of overcome that infection, right? If there's a certain threshold of antibodies you need in order to fight this infection and you're below that mark, yes, you mounted an antibody response. But if it's not enough to kind of fight the battle, you still lose. And that may have happened with Colin Powell.
Yes. So think about it. If you're in your house and you are this guy with six-pack, you're tall, you have these muscles, and some guy comes from the street, breaks into your house, he ain't even your size, okay? You're going to take him out, right? But if you've shriveled and you really don't have any power and somebody comes into your house, they're going to take away your TV because you don't have the power to fight them.
Even though you're in the house.
Even though you're in the house.
It happens.
Correct.
Yes. So it's just, so that's the complexity of an infection. Yes, he had the vaccination. Yes, theoretically it should have helped him. But because he was already in an immunocompromised state, his body wasn't able to produce enough antibodies and fighting cells to help overcome it. And it was just a double whammy for him. And I'm sad to have seen that had happened to him. So, and we have another question here. Charlotte Brooks had asked, are masks worn working out or should masks be worn working out at the gym and steam sauna? Should we be wearing masks?
So the thing is, who are you with? If it's like somewhere where people are not many around,
yes,
and you're vaccinated and the people that are vaccinated, I don't see why. So the principle really goes by who you're with. If you're in a sauna with your friends, are they vaccinated? If you're vaccinated, I do not think that would be necessary.
Okay. But if you're in the gym and you don't know,
and it's a lot of people, you don't know who's there, you don't know whose vaccination started, then you want to protect yourself.
Right. So it's really the company that you keep. Are they keeping up with their vaccination? If you know they are, then you can have a little bit of a loose protection. You may not necessarily, if you're vaccinated and they're vaccinated, you can forego the mask.
Yes.
But if you don't know the company in which you keep, or if you are if you're an immunocompromised person?
Oh, if you're an immunocompromised person, I say take all the precautions. I've just talked about this whole thing about their immunity is low. And the people that fall in this category is not only people with cancer or multiple myeloma blood dysplasias, people that have, it's not every HIV patient, by the way, because there are some HIV people that their immunity is sound because they are on their medications, they are doing fine. Majority of the HIV patients are doing fine, by the way. That's
Good.
a plug in there
Good. That's
because
very good.
we just had the HIV day a couple of days ago. At
Yes.
least majority of my patients are doing fine. You'll never know.
Oh, wow. That's really good. That's very
Yeah.
good.
Oh, HIV has been reduced to a chronic illness where we manage it like we manage diabetes. We haven't found a cure for
Wow.
diabetes. Yeah.
Yeah, I mean,
Yeah.
I vaguely remember the 80s and the 90s, and man, it was, you know, devastation. But for it to be now, you can be able to live with HIV, which I already knew, but you know, at least during this whole COVID pandemic, it's not, as long as they're, what is the key factors that is helping them, you know, in during this whole pandemic? Have you been able to pinpoint?
Yeah, the fact that they're doing fine. They on their antiviral meds.
Yes.
Now, yeah, the fact that they are on their antiviral, once they are on their meds, most of their CD4 count is
High.
doing good. Their
Yeah.
viral load is undetectable.
Low.
They are
Yeah.
literally, for all intent and purposes, normal,
Okay. So
and they can
again,
live normal lives.
yeah. So again, if they are maintaining their health status,
Mhm.
that is the indicator of them being able to withstand having COVID infection, or even when they do have it, having a mild form of it. What you
Correct.
just alluded, when HIV, it could be the same thing for diabetes. Keep
Correct.
your sugars controlled. For
Correct.
hypertension, keep your blood pressure controlled. You know, even if you have thyroid disease, take your thyroid medications, those sort of things. As
Mhm.
long as you make sure that your health conditions are stabilized, that helps your body be able to boost your immunity for any infection.
Correct.
That's what we're getting at, right? Okay.
Correct.
So let's have one more question. I think we have that from Julia Rivera. Hi. Is there any truth that the vaccines can cause kidney/liver disease long term? God have mercy on us all. Amen.
Yes, Julia, God have mercy on us all. Where did these people get this stuff from? Like, where did they, like, Julia, I'm not talking about you. I'm talking about the people that are saying these things. The COVID itself is what's going to cause kidney, liver disease long term. Because the way COVID goes, it affects literally all the organs in the body, and it can form blood clots in all this area, and it can cause diseases in all these organs. COVID itself is what's going to cause that, not necessarily the vaccine. I mean, which part of the vaccine is going to go cause problem in the kidney and the liver? What you have to understand, let me go back and talk about the vaccine itself, especially the messenger RNA vaccine. It gets given to us as a shot in the muscle. It finds its way into our cell. In our cell, it gets into the cell cytoplasm. In the cell cytoplasm, it utilizes the enzymes that we have there, okay, and makes this RNA that has been formed in there, right, into a spike protein.
Yes.
And that spike protein is what our body, our immune system now recognizes. I'm like, you are foreign. We are going to take you out. And they start forming antibodies, and then the T cell, the giant killer cell, and the giant T cell, all of them start forming the immune response to fight this antigen. What happens to that RNA that has been used up? Think about if you have a computer and you put this program in there and you're done with the program, you don't need it anymore. What the body does is that RNA that has been utilized has been spent. So it's not like one of those redundant protein that is scavenged out of the cell and sent to the dustbin of the body, which is processed and it's out. So that's why I say there's no mechanism with which it's going to go cause problem with the kidney or the liver.
Yeah, it's actually the actual virus, COVID.
Actual
When you get
virus
COVID,
itself. COVID
That's
itself
when
is
I
what
see
is
the liver and the kidney disease happening, the actual infection.
correct.
And we see that a lot so do you have time for one more question, and then we will get your last wisdom and slash advice for us all when it comes to COVID? So I believe Cherie, hi, Jennings Winston had asked, what can we do for someone who has contracted the virus? How long does it stay in the body?
Someone that has contracted the virus, hopefully, I hope that they do well. Most times, they would have gone through it already in less than 2 weeks. Most people is much less than that. Um, and then after that, once their symptoms are all done and like they have 2 weeks of no symptom, they can go get the vaccine. However, if they got the antibody transfusion during the time they were ill, then they will have to wait for 90 days before they can get the vaccine. Because that antibody is almost like the antibody you're going to make from the vaccine. So they've been giving us an infusion, but because their body didn't make it, it was spent out of the body, and it takes about 90 days for that to happen. And so once that 90 days is over, they can go get the vaccine itself to build their own immunity. How long does COVID stay in the body? I don't think that we are at this time know that, because the virus itself, the illness it causes gets spent out. What other remnant of it? I was just talking to my girlfriend the other day, who had COVID April, May 2020, still having symptoms, although this is a year and a half later, and she's telling me that she's now beginning to feel a little better. She still has symptoms of post-COVID, but she's beginning to feel a little better. We will have to watch and see how long it takes those people that had COVID and still having long COVID symptoms, how long it will take them finally to get better. I've had somebody that it went on for 6 months, for 8 months. Now I have somebody that went on for, now it's more than a year and a half. And I've had people that had COVID from the very beginning that still have some remnants like confusion, fuzziness, and all kinds of complaints.
The loss of smell and taste. It also
Yeah.
seems like it can be lingering, as well
Yeah.
as some headaches. That's what I
Correct.
sometimes
Headaches
hear.
and shortness of breath. Yeah,
Yes.
it's been weakness, generalized weakness. Some people, it's like I have a friend who told me when she wakes up, it takes some time to muster the energy to even get up. I have a patient in his 30s who can't even mow the lawn.
Oh, wow.
This is a year after COVID.
Wow.
Still. So everybody is different. There are people that get COVID and they come out of it, like that,
Right.
It's not necessarily for everybody.
And I mean, and I wanted to add on to this because I've seen patients who, got COVID like in June, and they're coming in maybe, I wanted to say they came in maybe August, October, and they still were positive for COVID. So,
so when COVID first started, there are possible questions of people that had COVID that they never were able to clear it. In fact, there is suspicion that that's how Omicron came about, because it has so many mutations. The suspicion is that it's probably somebody that had a very low immunity. Maybe somebody that has HIV, that's not under control, not under medication. So their immunity is so low that the virus cannot be cleared, and that the virus just keeps staying there for maybe up to even 6 months. And ends up getting so many mutations because there's so many iterations to these replications. Like the virus is there, if it can't clear because the immunity is so bad, like the patient is so immunocompromised that the virus persists because the body cannot even clear it. So how long it lasts in the body is a very loaded question.
Yeah, it is. Yeah, it is, because a part of it is it could be because of that, or it could be it's taken a while for your body to clear the dead particles from the system. And so when you get tested on, fragments of the virus, but not the live virus that was attacking your body has now died, and but you
So
still have some residual remnants of it that
we
is
had a
making
number
your
of
test to
cases.
be positive. Huh?
We had a number of cases like that in the nursing home where the
Mm.
patient has recovered from COVID. 6 weeks later, 7 weeks
Mm-hmm.
later, we were still testing positive for COVID.
Mm-hmm.
That is a case where you could think about the fragments
Mm-hmm.
from the virus still
Mm-hmm.
there and still causing positive test, not necessarily
Mm-hmm.
because the patient is still positive for COVID in the body. But there are situations where, like I was telling you, patients that are so immunocompromised
Mm-hmm.
that the virus doesn't get cleared at all. And the virus can stay in their system persistently and keep replicating and replicating. In that continuous replication, that's where you can see so many mutations. That's the suspicion about Omicron, by the way.
So let me ask you this question. So, and it's are they still can they still infect? Do they still have infectivity? Those type of patients.
Correct, they do, because they are replicating.
And so they have symptoms.
They have symptoms because their immunity is so low. They can't clear it. So they will have symptoms most times. And it might not be symptoms that are terrible enough to kill them. It's just maybe low-grade symptoms. But they are carrying that virus and they keep replicating it. And the mutations just keep occurring in that same person. And that's where you could see, because for you to amass so many mutations in the amino acids in one virus variant, yeah,
that means that it was in the system for some time for it to
likely.
for it to now, it was in the one hypothesis is it was in a body for such a long extended time that it was able to replicate and create mutations of itself all at that same time. Okay. Wow. Okay, now we're going a little scientific, but it's okay. I hope you guys were able to get an understanding. Thank you so much, Dr. Gertie and Annuoke, for coming. It's always a pleasure when you're here just to discuss about COVID-19. And before we end, I wanted to say one thing. I just wanted to read what Julia Rivera said. She says, she said the doctors don't help, but we're doctors and we're helping, teaching patients to eat healthy and take supplements. That's all it's about, which is better than some meds. Thanks. So no, Julia Rivera, we do want you to stay healthy. We want you to stay healthy by taking your supplements. We want you to stay healthy by eating healthy, exercising. Eating healthy, exercising is like the number one prescription that I always tell all my patients. You're able to get off your hypertension, your diabetes. A lot of people are able to, but I won't say everyone's able to, but there has been studies that have shown that people can be able to get off those chronic medications just by diet and exercise. Not everyone, but there has been studies that have shown that. So yes, eating healthy and taking supplements is key, but also taking your medications is key to stay healthy, stay alive, and boost your immune system so you can fight infections such as COVID-19. Dr. Annuoke, do you have any lasting words that you want to tell the audience?
Yes, I want to tell the audience that, again, people should take a deep breath, relax, accept that COVID has come with its variants, and do what you have to do to protect yourself and your family. Talk to your friends that are hesitant about taking the vaccine. Maybe it's that one day that would change their mind. If you know more, you've asked me these questions here, you've heard me talk. Take it back to your families, take it back to your friend circles, talk about it. That's how people start getting comfortable, because there's been so much misinformation out there that wasn't dispelled by, I don't know that anybody could have dispelled it, because the machine with which it was going in social media, you couldn't stop it, So it's like we are trying to catch up behind it. So much misinformation and disinformation. People just sit down and concoct stuff and just put it out there. And it's so easy these days with social media for things to go like wildfire, and bad information seems to fly better than good information.
Right.
So if you get a good information, take it to your family, take it to your friends. Ask more questions if you need to be clarified on other things. Get your questions answered. Do your own research. And I'm not talking about the research of, and I feel bad because I am an infectious disease doctor, so I know where to go. When somebody sees something that looks decent, looks official, and that's what they do. Sometimes they go get official logos and official this and that. Why would people try to do that to people? I don't know, but that's immaterial. What I'm saying is people need to keep themselves well educated. The sites you should trust is CDC, trust the NIH, go to your local health department. Those are the sites you should
Trust
trust.
your doctors.
Trust
Your
your
doctor that
doctors.
knows you.
Yeah. And those are the sites that you should trust. I mean, think about it. We all doctors, majority of us got it. If there's somebody said we were going to die in 6 months, I took my vaccine in December 2020. It's 1 year so far. And the first set of people that were in these studies were like end of April of 2020. It's almost 2 years.
Yeah.
And they are still monitoring them to see if something happens. Most vaccines, as far as I know, they've monitored 2 weeks, 1 month, 6 weeks, and people, mostly doing fine. But this one is going to go for 2 years. So I say all this to say that people should get themselves vaccinated. Do your social, if you have to do social distancing, especially with people that are not vaccinated and might be carrying COVID. But the biggest thing is wear your mask in areas where you don't know the status of the people. We should all take care. Enjoy your Christmas. Merry Christmas to you all and Happy New Year.
Hey, well, that's well said. Well said. Thank you so much, Dr. Anyawoke. Just like she said, share this information. If you want to, share it on your social media. Share. Talk to your family. Just have an honest discussion. Like she also said, also be careful of what you read on the web, what you watch on the web. Not everyone who has these beautiful backgrounds, like she said, are actually legit. She gave you some tips on who to follow, especially to talk to your doctor, because they know as well. We're all reading up and we are trying to get all the information so that we're well informed to be able to treat you. So make sure to talk to your doctor. Thank you so much, Dr. Gertie Anyawoke. This has been Q&A with Dr. Mercy. Next week will be Medicine for the People with Dr. Susan. You guys have a nice and wonderful holiday if we don't see you. And thank you, Dr. Anyawoke. See you guys later. Bye.
Bye.